We selflessly led the country's fight against COVID, racing against time, battling all odds.
It's a 10-hour shift in the morning, 14-hour at night. There is no break.
We fought hard so you could go back to your families soon. Even if that meant we stayed away from ours for days, months.
I think ये जो emotional breakdown है हम doctors में अब सबको कोई ना कोई समय हो रहा है because we've not been so helpless.
Everyone was singing our praises. We were touted as heroes, warriors, gods.
Powered by our corona warriors, India is firmly fighting COVID-19. वो डॉक्टर्स, वो नर्स, वो भगवान का रूप लेकर के भारत के उन लोग लाखों डॉक्टर्स, हेल्थ वॉरियर्स, हमारे डॉक्टर, नर्स, पैरामेडिकल स्टाफ, डॉक्टर्स एंड मेडिकल वर्कर्स आर लाइक सोल्जर्स.
The entire nation applauded us, hailed our efforts.
Oh my God!
Really? They're made out of coffee?
They're really dry. I don't feel anything.
But these incidents are forcing us to think if the praises are mere lip service and our efforts would soon be forgotten.
लानत है हमारे उन देशवासियों पे जो ऐसे काम करने वाले डॉक्टरों पे, नर्सों पे, नर्सेस पे हमला करते हैं. घृणा आनी चाहिए हमें, जो खुद अपनी जान की परवाह किए बिना दूसरों का जान बचाने के लिए इतना कोशिश करते हैं. आप उन्हीं पे हाथ उठाते हैं. आप कभी एक बार खुद को इन डॉक्टर, नर्सेस, कर्मचारियों के जगह पे बैठ के देखो एक बार.
It's unfortunate how we are under constant fear of being attacked, not just by kin of patients, but at times by the police too.
दिखाई नहीं देता है हेल्थ की गाड़ी है, ये दिखाई नहीं देता है सीएमओ की गाड़ी है.
On 23rd of May, when I was returning from my hospital, after performing my day and night shifts of the duty, I was stopped by police personnel at Badshapuri, Nagar. When I produced my identity card and also my car was bearing a logo and there was a sticker hanging in my car, despite all these evidences, the police personnel did not allow me to go ahead. When I requested him that I'm a doctor and I'm already tired, kindly let me go, he became furious and used rude language. Not only this, but also he caught hold of my left index finger and hyperextended it to near fracture. I cried in pain and agony, the pain I have never experienced in my life.
Threats, abuses, and harassment add insult to injury. All while we are under so much pressure.
सुनो, ये ऐसे 10 हॉस्पिटल में 10 डॉक्टर खड़ी कर सकती है. उनका लैंग्वेज मेरे रिलेटिव के साथ गंदा था.
पता नहीं कहाँ से जो बाहरी लोग आ गए 20 लोगों के सामने मेरे साथ इतना बुरा दुर्व्यवहार किया कि मैं इतना मानसिक रूप से व्यथित हूँ. मैं रो रहा हूँ. मुझे नौकरी नहीं करना, मैं नहीं करना. इतनी गाली खाने के लिए मैं पैदा दे दिया, मैंने इस्तीफा दे दिया, मैंने मुझे नौकरी नहीं करना.
In treating you, what happens when we get infected? We are denied beds in the same hospitals where we are fighting it out every day, every hour, every minute, every single second.
मैं आरएमएल हॉस्पिटल में डॉक्टर हूँ. यहाँ पे मुझे बेड नहीं मिल रहा है. यहाँ का डॉक्टर होने के बावजूद भी वीआईपी लोगों ने बेड भर रखे हैं. यहाँ पे वीआईपी लोगों को ही प्रायोरिटी दी जाती है. यहाँ के डॉक्टर से कोई नहीं पूछता है.
This is the state of some of the hospitals. Imagine having to work in these conditions. But we selflessly do.
टीम से जितने भी डॉक्टर्स, स्टाफ, नर्सेस हैं, सारे इसी तरह की ड्यूटी कर रहे हैं. उनके भी आधे कपड़े भीगे होते हैं, जैसे तैसे खड़े होते हैं, उसी में ड्यूटी करते हैं. ये आज की स्थिति नहीं है, हर साल की स्थिति है. कोरोना के काल में इस तरह के हॉस्टल की व्यवस्था, तो कोरोना के मरीज क्या इलाज होगा। साथ में कई तरह अनेकों बीमारियां फैलेंगी। गंदे नाले के पानी में हम लोग चल रहे हैं, ये हम लोग देख देख के थक चुके हैं। सरकार को इस पर कोई असर नहीं पड़ता है। ऐसा लगता है हम लोग एक डॉक्टर्स में एक मजदूर हैं।
Some of you feel breathless, wearing masks for long. Imagine working for hours at a stretch, often without breaks, while donning a PPE kit.
The PPE kit is actually very, very heavy. And once you go inside it, and inside the wards, it is, the environment there is so hot. You try to, you drench and you sweat so much that it becomes really, really difficult to move around.
You cannot see our emotions while we fight in these heavy PPEs. We run around the wards in them, so we can keep serving you. But imagine having to make do with substandard, torn PPEs, wearing used masks, worn gloves, because there are not enough for all of us.
Had dawned and gone inside to realize that there were a lot of shortcomings, right from unavailability of the soap and sanitizers to the donning doxing area being almost in the same corridor. The masks which were being provided to us were not of the standard quality, neither were the PPE kits. So the masks being provided were given in open, bare hand. In our PPE kits, the face shields we were being provided was that of indigo. In fact, even these sanitization tunnels were non-functional.
Salary do, salary do, salary do, salary do, salary do, हमारा salary do, salary do, हमारा salary do.
In the middle of the pandemic, with heavy workload, so many of us suffered the woes of unpaid salaries, along with job insecurities.
हम लोग अपनी रिस्क पे हॉस्पिटल आते हैं बिना रुके और काम करते हैं, ये सोच के कि चलो कोई बात नहीं, हमारा काम है, हमें करना चाहिए, इसमें कोई एक्सक्यूजेस नहीं होते। लेकिन हम काम के बदले में हम हमारी सैलरीज को एक्सपेक्ट कर रहे हैं ना।
ಮಾನವೀಯತೆ ದೃಷ್ಟಿಯಿಂದ ನೋಡಿ, ನಾವು ಕೊರೋನಾ ವೈರಸ್ ಡ್ಯೂಟಿಯಲ್ಲಿ ನಮ್ಮ ಫ್ಯಾಮಿಲಿನ ಹಿಂದೆ ಇಟ್ಕೊಂಡು ನಾವು ಕೆಲಸ ಮಾಡ್ತಾ ಇದ್ದೀವಿ. ನಮಗೆ ಒಂದು ಜಾಬ್ ಅಶ್ಯೂರೆನ್ಸ್ ಇಲ್ಲ, ಒಂದು ಹೆಲ್ತ್ ಅಶ್ಯೂರೆನ್ಸ್ ಇಲ್ಲ. ನಾವೇನಾದರೂ ಹೆಚ್ಚು ಕಡಿಮೆ ಆಗಿ ನಾವೇನಾದರೂ ತೀರೋಗೋದು ಏನಾದರೂ ಆಯಿತು ಅಂತ ಅಂದರೆ ನಮ್ಮ ಫ್ಯಾಮಿಲಿ ಬೀದಿಗೆ ಬರುತ್ತೆ. ನಮ್ಮ ಫ್ಯಾಮಿಲಿಗೆ ಯಾರು ಆಗ್ತಾರೆ? ದಯವಿಟ್ಟು ಮನುಷ್ಯರು ಅಂತ ಫಸ್ಟ್ ನೋಡಿ.
What happens when we demand the salaries that are rightfully ours? Listen for yourself.
Mr. Satendra Jain came, who's the health minister of Delhi, and we spoke to him about especially about the salary issue, but he clearly denied and said that you should not be complaining about all these issues, and you should be working and only serving for the people. Corona cases have declined, we can't be paying you so much, and you know, like and you don't want to work. Can leave and resign, and if somebody found not to be working, they would be thrown out. Yeah, we were disheartened by listening by this attitude actually.
About 719 of us have lost our lives due to COVID in the second wave alone. But we hardly have time to focus on our personal grief. We have so many to treat, many precious lives to save, battling all odds, racing against time. We do not want grand tributes. Do not call us gods.
All right. Can everyone hear me? Good. That's great. Hello, everyone. Hi, Dr. Bobby Mukanda, Dr. Sunil Kumar, Dr. Sri Hari Rao. I think we are still waiting for a couple of panel members, I believe. Dr. Jailal, and then I think Dr. Karthik. Thanks so much for joining me today for this discussion, Save Our Saviors. And I'm really honored to have the president of the chairman of American Medical Association, Dr. Bobby Mukamla, join us, and shortly, the president of Indian Medical Association, Dr. Jailal, also joins, and also Dr. Sri Hari Rao, who has been in contact for the past few years. He has been helping me in coordinating this event. He's the president of IMA, AMS, and Dr. Sunil Kumar Rao, Colonel Dr. Sunil Kumar Rao. I also had the pleasure to speak with him a few days ago, and he is the principal assessor of the Quality Council of India for NABH, which is the board that accredits the hospitals and healthcare professionals. And also Dr. Karthik Tumala, the honorary secretary for the Andhra Vijayawada chapter of IMA, will be joining us. Hello, everyone. So we can be very informal, just relax and chill out and have just a nice discussion today. It can be an intense discussion, but a good discussion about why we have to do this, about save these saviors. A lot of people ask me, why are you doing this? Why are doctors under so much trouble? And I also have to say that approximately 2 weeks ago, in the previous session, we had eminent members like Dr. Hari Prasad, the president of Apollo Hospitals Group, and also chairman of Sunshine Hospitals, Dr. Gurva Reddy, and many other prominent doctors, administrators who have vast experience are joining us for this program. And I'm really thankful to everyone who has participated so far. I think there are many panel members, many members out there also watching this, both on YouTube, Facebook Live, along with Zoom. And I want to welcome them all. Good morning to those people in America, and good evening to those people in India. Yes, I think Dr. Karthik Tumla has just joined us. Thanks, Karthik. Karthik, can you hear me?
Yeah.
Hi. Karthik, sorry, we can't hear you. The internet connection is unstable. Okay. Karthik? We can't hear you. Yeah, I think Dr. Jailal, the Indian Medical Association president, has just joined us. Welcome, sir.
Yeah, welcome. Another 5-10 minutes. I will be in the car, so I'll be reaching the room in another 10 minutes.
Yeah, thank you. I know that you're traveling and you mentioned that beforehand. So thank you so much for joining us. Yeah. So, and let me introduce Dr. Bobby Mukamla, who is the chairman of American Medical Association, to you. And we are very eager to hear from you all, the elite panel members, about this topic, saviors. And as you all have watched the video just prior, where doctors are being attacked, medical communities are attacked. And you know why I'm doing this program is approximately 4 months ago, and I saw there's a huge COVID second wave in India, and you know my people there suffering. I said, you know, I need to do something about it. So I actually started doing daily Zoom calls to help people there. Like every used to get up in the morning, 5 o'clock, and then 6 o'clock there used to be a Zoom call. You know, for India, of course, it is 6. And then soon I realized in that process that so much violence against doctors, and I have seen that personally, you know, speaking to different people and seen on TV and all that, and I want to do something about it, and that is how this program has started. And yeah, and I looked into various reasons why this is, over the past 4 to 5 months, you know, I have learned so much about it, but I want to learn from you people today. And I hope that we could do some kind of solution or direction that we can take. With that, I want to invite Dr. Bobby Mukamala to say a few and begin this discussion. Sir.
Thank you, Kieran. Can you hear me okay?
Yes, I can.
Okay, great. Thank you. Thank you for the opportunity to join this esteemed panel for this important conversation. It's an honor to be here to discuss the issue of violence against physicians, both here in the USA, but especially in India. And honestly, I can't help but reflect on things I was taught as an American-born Indian growing up, attending Sunday Bala Vihar classes. And one of the first things that we were taught about is ahimsa, right? Or nonviolence. And it's something that we are exposed to constantly, you know, throughout our, studies in my Sunday classes. But even on the history side of what we learned, we were taught about nonviolent resistance that was championed by Mahatma Gandhi. So throughout my childhood, violence was always discouraged and peace was always held on a pedestal as something to aspire towards. And yet here we are discussing a very dark subject about violence against doctors. And while there's, certainly some of this occurring here in the United States, the epicenter of this plague seems to be in my ancestral home of India, where many of you are. And so the very land of Bharat, that non-violently achieved its independence, where more than 1/3 of the people are vegetarian because they believe so strongly in ahimsa. This is also the land where 75% of doctors have faced violence at work. And it seems so inconsistent with the principles that made India a great democracy, yet here we are discussing this huge problem. But again, it's not unique to India. There was a recent study of 145 doctors here in the United States that showed that 59% had experienced verbal abuse and almost 10% had been exposed to physical abuse, mostly in the hospital settings, some in the community settings, but that's a rate that's 5 times higher than other industries. So clearly an outlier even among US occupations. And it's not just in-person threats, but in this era of COVID, the division that's it created in our society has brought out threats on social media. In fact, I had a letter mailed to my office and another one mailed to my home, telling me that I should go back to the dictatorship of India because I was not welcome as a non-white American here in this country. The letter just came about 10 days ago, and we sent it to the FBI for fingerprinting because they wanted to see, who may have written such a thing. So, I guess I'm honored to be here to discuss this important topic. I'm hoping that we can learn from each other about ways to emerge from this chapter of practicing medicine, both in India and the United States, so that we can at least continue to practice our profession to help people without putting ourselves at risk. There's already enough risk from this COVID virus, let alone risk from violence from the patients that we are treating. So excited to participate. Thank you very much, Kieran.
Thanks so much. And as Dr. Mukamala said, the violence is not just in India. It's in America, it's in China, it's in Australia. The statistics show a steady rise of violence over the past decade, actually. And in America, another study showed that 78% of emergency physicians say that they have faced violence or abuse at some point of time, and they're worried about what's going to happen to them. And that's quite unfortunate. In India, the situation is quite dramatic that we have seen, and everyone hears from IMA. And more than 70% or actually 80% of doctors felt threatened at some point of time. Now, I know that back in June 18th, I believe, Indian Medical Association has called for protest against this violence against doctors. So, Dr. Jailal,
give me 5 more minutes.
Please,
give me 5 more minutes.
Yeah, 5 more minutes. You need 5 more minutes. Okay, Dr. Srihari Rao Garu, can you please tell us a little, what led to that kind of a nationwide protest? 3.5 lakhs people, that is 350,000 people, doctors, came out on streets, and what happened after that?
Good evening, everybody. Today is a historical day. Indo-American Summit.
Your voice is audible. Your voice is breaking up.
Good evening, everybody. It's okay.
Yeah. Better. There is some disturbance. Yes, please go ahead. Yeah.
It's a historical day. The Medical Association National President, Dr. Jailal sir, and the DAS and American Chairman, American Medical Association, Dr. Bob is there, and other colleagues.
So we can hear you because the voice is breaking up. Maybe you need to take the mic and put it close to your mouth, I think, or or remove that and directly speak on the computer. Thank you. Yeah. That probably it is going to be better.
It's okay, sir. Good evening.
Better, yes. Sometimes technology makes it more difficult here, I think. I always have trouble to than these things. Yeah.
Okay. All right, sir. As I told you, Indian Medical Association is a multifunctional and multifactorial, multi-faced organization. We have 3.5 lakhs members with 1,750 branches all over India. And it is the largest non-government organization in India. As my president is a active, dynamic personality and proactive for medical. Any problem, he will be the front line and fighting for all the medical fraternity. As actually we are fighting on June 18th for the demands of the IMA, Central Hospital Healthcare Professionals Protection Act with IPC and a Code of Criminal Procedures. And also standardization and augmentation of security in each hospital and declaring the hospital as a protective zone. On that day, all over India, our doctors are come out from even though there is a COVID protocols are maintaining, but our strength is known by the government of India, and they have called for the tax regarding this Save the Saviors. We are also called for the Save the Saviors on that day. The title is, and where the fighting against the violence against the profession and professionals we called on that day. And in our country, since times immemorial, the doctor's profession has been considered as a noble one, being a savior of life and hence given the highest regard in the society. Even the present days, since the beginning of the outbreak of the COVID-19 pandemic, healthcare providers have been shown more support solidarity and gratitude than ever before. And there have been instances when attacks on doctors have taken place sporadically. This alarming trends reinforces the need for improved means to protect the doctors and health providers from acts of violence. As you know, almost you told before, 80% of the doctors are facing this violence against every individuals. And regarding the profession, you all know, the earlier days, medical practitioners were required only stethoscope, BP apparatus, and one table. That is enough for the practice. And the patients also the confidence over the doctors. And if anything happened to the patient, it was felt to be misfortune or God has given only that much of lifespan. So nowadays, doctors have to start with all facilities under one roof with the latest technology and equipments. It's very cost effective. Every patient, such as Google, comes with prefixed ideas and also has suspicion about doctors, investigations, and his diagnosis and treatment. So nowadays, doctors feels that every patient is a litigant, and therefore, if anything happened, he blames the doctors. And in case the patient dies, the doctor is taken talks on the ground that the doctor question has become a commercial. This is the nowadays the feeling of the government and the patients. Kiran.
Yes, sir. Sir, thanks so much for sharing that. And I want to say this here. You mentioned many important points. One is the scenario has changed quite a bit compared to what it was 30, 40, 50 years ago. And even when I did med school, like 20 to 2 years ago, the scenario has quite changed. I never saw my officers, and other doctors that I know worried about anything of this sort in India at that point of time. But now every single person, every one of my colleagues that I speak with, they're like, what's going on here? And I know that personally, every single of them I spoke with are good doctors. Okay, yes, in society, there will always be some bad apples. It doesn't matter what profession that you are in. But I can tell from my experience and having worked with thousands of doctors that most doctors intend well. They want to do good for the patient. No one comes out there saying that I want to do something bad. But yet, why is this such a bad perception these days? Oh, they're just there to make money. Or, they are just charging, thousands of dollars. They don't care about us. Why is that perception? Dr. Colonel Sunil Kumar Rogar, can you please share with us your perspective about it? Why is that?
Yeah, good evening to Indians and good morning to Americans. I have been invited on 2 counts. Number one is I am from NABH also, that is the National Accreditation Body. And the second count is that I am a chief administrator for Gujarat Cancer Society hospitals, group of hospitals, which are cancer hospital, as well as a medical college and hospital. And previously, I have been working in various hospitals as administrator, as in charge administrators, and have faced several such incidents which have been shown on television, as well as which have been shown just before we started. Many of these are now become routine, as you said very rightly. There is no doubt about the trust deficit. Even the CII FICCI report for our country, for India, for the hospitals, clearly mentions that the biggest threat to the healthcare business today is the trust deficit, which is there between the patients and the doctors, which has come up as a big factor. Major reason which I feel as an administrator, doctor administrator, I am stressing on that because there are multiple administrators of different types who are interested more in making money and showing the P&L as a positive and make profits year after year, keep on increasing the rates. So these tendencies which have cropped up in our medical field is one of the reasons which all the doctors perceive, because doctors clearly feel that the payment which they receive vis-a-vis the hospital receives, there's a tremendous amount of gap in that, and the patients definitely perceive that the doctor himself is taking that much money from the patient, and does not explain enough why that money is needed. For example, even in the NABH, now we have made it compulsory to do a multidisciplinary counseling, which includes the person from billing, from finance, to give the idea as to if there is a costly medicine. Suddenly we start injection meronem or meropenem and various antibiotics. For a common man, which we are treating, treating mostly below poverty line patients and those which are in the government schemes, and those really feel the pinch of it, that if there is any change in the billing. So any factor which changes the billing of the patient must be explained. So that is where the trust deficit keeps on increasing. A person, if he is not explained anything. Another thing which we have introduced from the NABH side is the effective communication. That also it is called enhanced communication in terms of various situations which arise. For example, a young patient dies suddenly in the hospital. Definitely that's a big red factor as far as violence is concerned. And most of the incidents which you must have observed are when a young person dies in the hospital, and inadequate explanation is perceived by the patient's relatives, and some miscreants who mix up with the relatives of the patient definitely create a further fights and things like that. So I feel that the trust deficit has increased multifold because of inadequate explanations, not only by the doctors but the healthcare professionals. I would say we work as a team, right? So when we work as a team, it's not only doctors' responsibility, it is the administration's responsibility, it is the nurses' responsibility, it is the team's responsibility to explain in whatever manner. Most of the times what happens is our colleagues, our fellow paramedical and medical professionals and nursing professionals just point it out towards the management has changed the policy, or they say that, this particular medicine you will have to buy, otherwise we cannot buy it from outside, you cannot do this, you cannot do that. And then slowly that starts increasing, that frustration amongst the patient relatives start increasing. I am not trying to side with their side of the patient side, but you look at it from a poor man's perspective, that if they are not explained in time, especially when the patient is young, critical, and at the verge of death, has traveled multiple hospitals, by the way. This is also a new phenomena in India which has started, that people are so much wary that violence may erupt in our hospital, so they pass on the buck to another hospital, thereby increasing the trust deficit further. That means you are making sure that the other hospital suffers because you are postponing the event by passing on the buck to another hospital. So these some of the factors only I'm explaining. Multiple other factors are there. Definitely, I think my fellow panelists will also throw a light on this trust deficit, which is increasing further and further.
Sure, sir. You nailed the problem right on its head, which is lack of trust, loss of trust. And that definitely is, opinion, the cause that is leading to all the problems. When there is loss of trust, whether it is a personal relationship at home, whether it is a relationship at work or in the system itself, that is when people resort to violence or some kind of problems. But if you actually, there is a slide that I shared yesterday for this presentation, and the number one is loss of trust. And that is what every single doctor who has attended this panel so far has said, loss of. Why is that? I want to ask our IMA president, Dr. Jayalal, sir, why do you think there is such a loss in trust? What do you see, being the head of such a big organization and hearing from a lot of doctors and probably hearing from a lot of patients? What do you see?
Yeah, I fully agree on the trust deficit concept, but you must also realize trust deficit is not only in the medical profession. It is happening right down in our family. The amount of respect and amount of relationship with the parents, children, what the older generation had has totally gone. Now it has become more of a knowledge-based relationship where it is coming. What's the time of the time the patient has to fully depend upon the doctor for the everything, and whatever the doctor says the patient was able to believe. But somehow, whether it is a right or wrong, the social media and the Googles are able to give some negative or improper inputs to the minds of the people. So that always brings some questions into the relationship. That is what resulting in the trust deficit. But what I personally believe that this is a changing phenomena, but the doctor community should also learn to cope up with that. Professional violence is a challenge of a professional hazard, which we must be also acute enough to face and acute enough to, address to that need. And we cannot say that it is rising so that we are going to go away from that, and it has to be, one has to really face that. There are many ways for that, because if you see an hospital, it is always an hospital is a human intensive organization. All the people inside the hospital, whether it is a doctor, paramedical person, the attender or the patient, everybody will be in a tense mood. None of them will be in a normal mood, including the doctor. So when there is a four kind of people, when they are meeting together with a different kinds of perspective and a tensed mood, there is a violence is bound to happen, have to happen. And at that point of time, then how our hospitals and the medical profession is making themselves equipped enough to face that, solve it, identify the when it is erupting, and controlling it is the most important thing. Since you are talking about the saviors, and the medical profession also say teaching, one of the other area which is worrying me a lot is a professional violence which is taking place within our medical profession itself. The amount of violence, whether it is a verbal, whether it is not mostly physical, it is a verbal and mental, torturing. Then the mentorship situation, whether the students and the medical professionals are undergoing, is much more the real literal violence which we are facing in the society today. If you see, we are going through the students across the country, the doctors across the country, what they feel is the amount of stress they feel inside the teaching profession, the hospital professional, by their own seniors, by their professional elders. By that is one end. And second, in the corporate hospital, by the multinationals and by the corporate owners with the for-profit or oriented hospitals, what they are getting the mental torture, and if they are not meeting out to 100 cases per month, and that amount of the turmoil and the face challenge they are facing, there is another component of the save the saviors which we need to rise to that occasion. Where yes, we get the violence from the society, which we get the violence from the patients, but we do get the violence inside our house, inside our home, and that should be also addressed to the need of the people. So I will only say it is going to, we can never eradicate the violence. Violence is going to be the part, because it is going to be the trust deficit is so high with the knowledge exposition is taking place. But now our intention, our focus as an organization, IMA, we are now focusing on how to solve this and how to prevent it. That only brings by the unity of the doctors, interconnection of the doctors, and not talking anything bad about your colleague, and always understanding and interacting with the colleague. Always believe that you are also at the vulnerable end, and mutually trying to help with the colleagues, and forming a network or union where that you will be able to support whenever your doctor colleague is in the problem. That is what we are now, IMA is focusing on that, on the professional violence and preventing the violence which is happening on the society.
Thanks, sir. Thanks. And actually, thanks for bringing out this topic also, where it is not just coming from outside, but it's also coming from, it is, from within, where I know, like, doctors being threatened or put a lot of pressure either by the administrators or other doctors, senior doctors on junior doctors. It's entirely separate problem. But, this also brings to the point, but what is actually violence? What constitutes violence? The definition. Because violence is simply an act of, hitting someone, physically assaulting someone. Yes, that is one part of it. But violence is also defined as telephonic threats, intimidation, verbal abuse. All these things constitute violence when you take that, because people are afraid when something happens. If someone calls you, like Dr. Mukamala got a letter, right? Saying something. I mean, that definitely creates a lot of fear in us, and that prevents us from performing properly in our. I want to say this: violence against doctors is not just a doctor problem. It is a public problem. It is a public health crisis. This is this. If doctors are under stress for whatever reason, if they are afraid, they won't be able to perform well. It is known very clearly, and Dr. Mukamala will know more about physician burnout and stress leads to medical errors. Medical errors means it is not good for health. Medical errors is the third leading cause of death in America, right after cancer and heart. So pressured doctor, a stressed doctor, he menace to public health. So there's a public health crisis. That's the reason people should be involved. You need to know that violence is not the solution. Violence is not the solution for anything. How do we solve that problem is the question. Now, what is the root cause? What is the root cause for this problem is what I am interested in. The reason is we won't be able to solve any problem in our life unless we truly understand it. 50% of the solution is understanding the problem itself. So from that perspective, I want to ask Dr. Mukamala, what do you think is the root cause, sir, for this problem? I know that we both live in America, but we are both connected to India, but we follow the news, we speak with our colleagues. So give me your perspective. I want to get to the root cause.
Yeah, I think of it as, my mom is a pediatrician. She's retired now. In fact, today she's flying back to Vijayawada from the USA. And I remember spending time in her office when I was a young boy, just sort of doing paperwork, filing her charts away, cleaning up, things like that, just because I was cheap labor for her. But I saw the interaction she had with her patients, and there was basically just two office staff, herself and her patients, and she got to spend time with them. There was minimal paperwork, minimal computer work. The face-to-face interaction between a physician and their patient in that generation seems to be drastically different today, right? So it's become from a very personal interaction to a very impersonal interaction, right? Multiple non-clinical people interacting with patients, paperwork, insurance verification, all of these extra steps. I mean, the fact that in the United States, we have 1 million physicians, every single one of those physicians has 1.5 full-time employees just working on prior authorization to do the care that they think their patient needs, right? 1 million physicians, 1.5 million office staff just working on prior authorization. And so, that's something that our patients don't like, right? If I tell my patient they need a CAT scan of the sinuses to see whether or not the pain is due to sinusitis or a mass or some neuropathic pain, the fact that they have to wait to get that CAT scan for a week or more, and my office staff has to work on getting their prior authorization, it just creates frustration, right? And so that frustration, especially for patients in pain, patients that are in dire straits, they're waiting for their PET scan to see if their head and neck cancer has metastasized or not, and that requires prior authorization. So for a week or more, they feel like the cancer is spreading every day while they're waiting for this CAT scan. That frustration needs an outlet. And so I think what we're seeing is that the outlet of that frustration is directed towards anybody and everybody, to the person that's checking them in at the office, to the physician that they see, to their family at home. And then, you can multiply that by a factor of 10 when there's something like COVID and there's social isolation, less ability to have conversations because everybody's at home with masks on. And so, I think it's just the sort of corporatization of the care that's being delivered and all the multiple steps that are now required compared to when my mom was in practice one generation ago that adds to the frustration, and the outlet of that frustration is this violence.
Well said. Well said. Well said. And for people in India to understand what is prior authorization, it is when someone has insurance and then let's say Dr. Mukamala orders a test. Sometimes he can simply order it and he can get it done like simple X-ray. But if you need a CT scan or MRI, the insurance people take a look at it. Oh, you don't need it. Why do you need it? So they come and deny it sometimes. That is very frustrating. Or they will take 2 weeks, 3 weeks, 4 weeks to actually authorize and then to schedule another 2 to 3 weeks. All these frustrations is what Dr. Mukamala is talking about. And I mentioned this in our last meeting, and actually prior to other meetings too, that in India, we are under mentality, some of the doctors, that, insurance is going to solve the problem. But in my opinion, it will solve maybe some problem, but actually it can create many other problems that we don't even foresee right now. So it is not a unidimensional problem. This is a multidimensional problem that requires a multifaceted approach to solve it. Now, coming back to what Dr. Mukamala said, the simple doctor in that simple office taking care of the patient like a friend, like a family member, that's lost. And this is another major thing many other panel members mentioned before too. Loss of the family doctor structure. That is at its core. Because previously they used to have, I have this doctor, he's just in that little street, two streets away from where I live. Always go to him and ask him and give the answer. That family structure is gone, family doctor structure. I see that as a major problem. The second is medicine as business is a common theme that I have constantly from various panel members. What do you say about it? I want to ask Dr. Tumala to comment on medicine as business. Dr. Tumala is a cardiologist, interventional cardiologist, and also honorary secretary of IMA Andhra Pradesh Vijayawada. Sir, please go ahead. Share your perspective on that.
Greetings to Dr. Kiran for his lovely meeting of international collaboration with our IMA India and as well as AMA with Dr. Mukamala. So I sincerely have my greetings to both of them. Thank you for accepting and me being a part of it as well. And I also have my greetings to Dr. Srihari Garu and as well as Dr. Srihari of Gujarat Oncology as well. So coming to the problem, so I was very excited when Kiran told me that he wanted to have a collaboration between both the medical associations of the biggest organizations in the world who are actually working on the same similar lines. So first, I would like to comment on what he has asked, like medicine as business. And as you said, I forgot to mention Dr. Mukamala Paragaru's father. My grandfather was his teacher. So that is what the 3 generations of doctors in my family. So I've been through all generations. There's just not 30 years. I've seen I've seen 40, but even more as well, the family. So as he rightly pointed out, Dr. Bobby, it's going to be a paradigm shift for all the generations as well, as we have seen people being almost like living at home. When I was a kid, when my grandmother used to practice, so they were actually living in my home. So people used to come live with us and then get treated and go back home. So next came my father's generation, where they used to come, greet us, give us some things, and be with us for some time and get treated and go. So now it is more like they come, they get treated and go. So there is a paradigm shift as well as in the patient's approach to a physician. And as a physician as well, we have been almost the same, but there are other corporate structures which have formulated over a period of time. So this changed the whole scenario of healthcare all across the world. And as we see this, there is a lot of business coming into medical healthcare, and you can see a lot of investments. People are excited. A lot of medical healthcare facilities, which were actually only for patient care, but now only talking about P&Ls, as we can see Dr. Siharigaru is also talking about P&L, what about the EBAT or CBAT or whatever. I don't know all those financial terms either. So I've been practicing from morning. Just now I got time to have my lunch. Now it's around 6 p.m. So that is how we used to work. But whereas our managements would be talking about more like how much generation is being done and what would be the profits and what should we do with it. So this is how there is a paradigm shift. We have to accept it because that is how the industries have been run, and we can see the pharma giants which have run all across our practice, and we have seen a lot of new molecules coming in which changed a lot of practices as well. And coming to the basic point of violence against doctors, as Dr. Mukamala has already told, that there has been a phased manner even in US, where they've come to medical legal cases. Now they're coming up to abuses, they're coming up to beating up. So as I was excited when there is collaboration being done by IMA, which has been a lead of various violence against doctors, as Dr. Kiran has pointed out, that June 18th was the day when we had a day of protest against violence against doctors, as led by Dr. Jailal sir. We have been a part of it, and we have recognized a problem. The root cause is predominantly there is a distrust or the trust factor which is being deficient, and we also talk about financial issues being implicated into most of it. So both of them should be solved by an international collaboration. And as we see, if something starts in US, the kind of policy making which starts in US will translate or will benefit the entire world. So we are just not talking about some policies being done by us and various facilities at the state level or at the national level, or we should think of an international level solution for this kind of a problem. So we already have a state level kind of policy that if some violence happens, that is going to be a homicide, kind of culpable homicide. So they will be imprisoned for the minimum of 6 months and kind of even going up to 2 years as well. So this kind of policies have to be continued, and this has to be recognized, and various levels we have to solve this as a guideline. So as I was Kiran, we should have a collaborative. This can be included in the routine teaching practice for management staff as well. And are you audible? Am I audible, Kiran?
You're going in and out, Karthik. So you're going in and out.
Am I good now?
Yeah.
Okay.
Good. Yeah.
Okay. So I would like to request both the associations to come up with some kind of collaborative guidelines which can guide the younger generation to for a better future and to actually get this solved, that get these kinds of problems to have some kind of broad-based solutions that can also be modified as a territorial-based problems as well. As we can see, there'll be more of medical legal cases in US. We should discourage them going to medical legal cases as well, so that there'll be lots of negativism which will be thrown out of place from the policymakers as well. So collaborative guidelines is what I request to be set it up, and even a book. I think Kiran likes writing books as well, so he should write a book on something like Stop Violence Against Doctors, guidelines to stop violence against doctors, and things like that. So so I answered most of your questions, and I had my comments as well. So thank you very much for giving me an opportunity on this platform.
Thanks, Karthik, for the offer. You're adding a lot of work to my already very busy plate, but with all your help, if that is going to help people, I'll be happy to. But here it is. Every single person so far in this conversation mentioned something common, that is loss of trust, right? Every single person, without a doubt. Now, what I'm going to do is I'm going to share my thing briefly. Hey, Srinija, can you please give me the ability to share my screen, please? Yeah, because I want to get to the root of the problem. I truly believe unless we truly understand the problem and taking a multidimensional approach, we won't be able to solve it. I'll start off actually talking about it, and once I get the screen share option, I will actually share it. So the loss of trust, there are 1, 2, 3, 4, 5, 6, 7. There are 7 factors that I have written down here based on my understanding so far. And I want your comments on that, okay? Because we need to get to the solution. And number 1, perception in public that doctors are money-minded. Corporate hospitals overcharge them, and wrong information is being given to them to make them get treated in the hospital. Now, whether that is true or not, that is a totally different issue, but perception is such. And I want to ask the IM president, Dr. Jailal, to comment on it. The perception in the public that doctors are money-minded, corporate hospitals, is this true? And if such, is that true? 10%, 20%, 50%, 50%?
So it is majority, it is true. They think doctors is an unavoidable evil and they are earning money out of their sickness. So always that is one of the very common problem, which most of the time the violence is taking place, or pretending violence is taking place only when they do not want to pay for that. And something that death happens, it is definitely not because of their anguish against the doctor or the hospital. They thought they're thinking that when they are making a fuss on that, then they create some nuisance on that, the hospital will let them off without paying that. So we have interviewed few of these incidents and people, and majority of the time the money and the perception of that the money they are taking more is one of the very most important reason, which is stimulating, or people are tend to more do the violence at that time, and they are getting some benefit out of that. And now there are organized groups are there, some established gangs are there. And if you see, we studied and violence taking place different hospital. In most of the hospital, the particular group is involved, so they immediately go there, they make something like a dialogue, they carry on, and they get money on that. And so both the perception of money they are going to spend, and another perception of they can extract money. So both this is becoming a major reason for violence.
So money is the root cause of all violence. That is what I'm hearing. Well, I don't exactly mean that. I know you didn't exactly mean that. But how money is just a tool, how we perceive it and how we use it is the problem, actually. Now, Dr. Gurwa Reddy from Sunshine Hospitals mentioned in the previous session that most hospitals that he knows, they do not overcharge patients. Yes, there are some hospitals who do not provide proper treatment and they charge a lot of money. Yes, there are. But that is what I understood so far speaking to these people. And also the cost of healthcare has gone up significantly over the past 1 or 2 decades because of various reasons. Number one, the advancements in medicine, right? 20 years ago, when I was in med school, I rarely saw anyone getting a CT scan or an MRI. Now, every single person is getting a CT scan or MRI for one reason or another reason. And even during COVID times, a lot of tests are ordered. So the cost of caring for people has gone up significantly. That is one reason. The other reason that I also understand is if someone needs to have a hospital, then there is the cost of real estate. For example, in a place like Hyderabad or Mumbai, if you have a hospital, you're running a hospital, the cost of real estate is so high and you're paying for it. also in Andhra Pradesh, it seems, and Telangana, it seems, the electricity is being charged at a commercial charges for hospitals without having any subsidies. And all this, there are multiple factors that they mention, how the cost of having a single patient in your hospital for simple treatment can cost like 2 lakhs, 1.5 to 2 lakhs, a simple pneumonia patient. Now, whose fault is it? Is it the hospital's fault? The charges are so high. Is it the government's fault that everything, the prices are so high? Who should we blame? And also, why are we importing so many technologies? Everything is imported, right? Everything that we do. There is no innovation inside the country. Everything is imported, and that rises the cost. Whose fault is it? Is it doctors' fault? Then why are doctors being blamed, or why are hospitals being blamed? I want to hear from Dr. Sunil Kumar Rao, because you're also a CEO of a group of hospitals, it seems to be. So I think you may have a great insight into this. Now, I will come down to other aspects there, for loss of trust, which is poor communication, and lack of family doctors, those other things. We'll get there, but I want to tackle one topic.
Yes. Yeah. So first, you have mentioned about the loss of trust has been commented by many panelists.
Yes.
The first thing is that the cost of medical care definitely has gone up. There is no doubt about it. But at the same time, if you think from public perspective, public also wants to get treated by good doctors. And many of the good doctors are in corporate hospitals or private hospitals, or their private practice is there. So you can imagine the poor patient also wants to go to these hospitals. And the moment his money or her money is over, all these other problems start off. As mentioned by IMA president also, that it just takes some time, and the interference from various organizations starts. Like I was CEO of one of the private hospital groups, where there used to be regular negotiation with such type of organizations, which are in Marathi it is called Rugna Hakka Parishad. So it is this type of organizations are flourishing everywhere, and always they are being given fuel by the politicians, local small-time politicians, to make themselves big. And media, of course, is biggest culprit today in creating this mistrust, because any of the stories is like, sells like a hot cake. So immediately it is taken up. Even if it is very, very small miscommunication from the doctor or from the hospital side, it is immediately painted as if they have done some crime, which is again adding fuel to the fire of mistrust and creating further problems, and miscreants getting into this. Like this Rugna Hakka Parishad I mentioned, they have made big posters. One of our political parties also during COVID times, they have, with the photograph of their leader, put up the posters just across our hospital, of every hospital, every branch, that if you face any problem with money, any problem for paying money, please contact us. Our leader is so and so, national figure. By the way,
we see slightly different picture here, Dr. Sunil Kumar Ragaru. Yeah, yes, that's a good point. We see slightly different thing. When I drive every day, there's a big billboard, like where it says that advertisement, the lawyers say, if you have problem with this doctor or with this thing, you call us this number and we take care of it.
Same in India. Same thing is happening in India now, that these miscreants are creating problems. Even if the person, the patient, I have had incidents myself in my hospital, where the patients have agreed, patients' relatives have agreed, but these miscreants never allowed them to agree to the this thing that we will settle on such and such aspect. So these type of incidents are happening, and they are increasing in multifolds. And that is how we have to, in my opinion, the best thing is to get together, act together. The police is the least supportive of all. All these acts, Medical Protection Act and all, are only on paper. What happens, we have all gone together as local IMA along with all the members of the hospital association to the police commissioner against one of the violence cases. And he clearly told that, suppose I slap you in the middle of the road, what are you going to do? It's a non-cognizable offense. So it is never linked with any criminal procedure, criminal penal code act, and it is no longer valid. And even if I beat you here, what are you going to do? You're going to do nothing. And nobody is going to even register this as a cognizable offense. So leave aside the investigation into it. So we as doctors, as well as hospital owners, as well as hospital administrators, we have to find solution for ourselves. This is not going to come from the government. Government may be doing certain things by passing some act or by passing certain regulations during COVID times. Fortunately, the government has passed this under Epidemic Act compulsory, certain penalties, but those are very, very limited. Now that already we are facing the situation where there is no COVID patient there, and the government is not helping, the police is not helping in this cause, we have to help ourselves. I am of the firm opinion that we have to build up such type of protocols wherein we all, fight together. And this is going to stay. The violence is going to stay, as Dr. Jailal also mentioned, that this is not going to go away. It's probably going to increase. Sorry.
I hope not. I hope it doesn't rise anymore, and hope we can find solutions to bring it down. But I want to ask Dr. Srihari Garu about what Dr. Sunil Kumar Rao said. The government has passed, I think, some kind of policy or regulation on since the AMA, the event on June 18th, right? What exactly did the government say, and is it being enforced? What I hear is, yeah, it is not being enforced. No one knows about it, really. Sir, you are muted. You need to unmute yourself.
Yes, sir.
Yeah.
We have the Act 11 of 2008. That is given by the Dr. Y.S. Rajshekar Reddy Garu during his period. At that time, our doctors are fighting against this violence. In Hyderabad, one incident happened in the Usmania students, junior doctors. One day we have called for strike. It is under the Dr. Apparao Garu is given call. But within hours, our CM called the leaders of IMA and the health minister, Dr. Arnu Kumari, Galla Arnu Kumari, the health minister at that time. He called and met and discussed with the doctors' problems and given issue this first ordinance in 2007, but after that 11 of 2008 Act under the Act is implemented, and after that 19 states have got the same Act, but they are insisted in that 3 years imprisonment, and there is a Revenue Recovery Act also added in that Act. For that Revenue Recovery Act, any loss happened to the hospital, they have to recollect that amount totally 200%. And this non-bailable act, 3 years. 3 years and imprisonment is for 3 years. But now that is not.
Is any of these things? Any of these things being enforced?
There is no single case file on this act because there are 3 years. Nowadays, the 7 years is the non-bailable act. We are fighting for that now. That 7 years must be added. Otherwise, it is non-bailable. It is a bailable act. 3 years, and also we have to enforce in the police manual. Actually, there is no information to the lower cadre. There is no information to the station officer level. There is no information to the SP level also. We have conducted a seminar with.
Sir, your voice is breaking.
we are conducting one conference with the DGP in Tirupati, but he does not note this act. But how can you know the lower cadre? So that is not implemented. But that's why we are asking for the central law for the against this violence against the doctors. There are other incidents, acts are there, but they are implementing the pandemic act and disaster management acts also on the doctors they are implementing. But we want the national act for all the states with the 7 years imprisonment. And immediately they have to take, arrest the culprits who are causing this violence against these doctors or paramedics, anybody. And also government has to improve the hospital infrastructures in government sector and strict implementation of the rules and acts and punishment for violence against doctors, hospitals according to the appropriate rules. Kiran.
You know, one of the things that, thanks very much. And, you know, one of the things that triggers my thought when you mention some of these points is that there is a huge gap between public perception of who doctors are and medical communities are and how we perceive ourselves. There is a huge gap. Everyone sees that, right? In this panel here, everyone sees that. We are thinking we have been working all our lives, right from childhood, you know, studying hard, going to medical school and so much stress, pressure. And after you'd come out and then again, you're working tirelessly day and night to become a doctor who you are, right? But people are not seeing us that way. We are seeing ourselves as saving people, but people are not seeing it that way. It's because of, I think, in my opinion, medicine has become business, both in America and India, unfortunately. Now, business is not wrong in my opinion, but how are we conducting that business? Number one. Number two, transparency. That is something that I heard from previous panel members, transparency of what we're doing. Transparency. I think Dr. Srihari Rao Garu had to leave because there's another conference at this time. Thank you, sir. So transparency. Why does this cost so much? If every hospital has its on their, you know, when patients waiting room or somewhere else, like it costs so much to get the MRI, it costs so much to get the CT scan, it's not cost so much to get so and so. And this is what it is. If you give the breakdown, is it going to help? Question to Dr. Jailal.
Yeah, that's a very good question you ask. The business, I mean, business is not an unholy word. I think this is unfortunately, once we come into the medical profession, we think that the business is a word which is a forbidden word. We should realize that the government and everywhere now we are recognized as only an industry and a business, and we should know the business in a very transparent and a perfect way. It is not that easy to put that what is their expenditure and or put the CT scan, how much it will cost, and that is not the exact way of doing the business. But the way of doing business is the mindset of our doctors has to change. Whenever you get a coffee, when you get a coffee from the tea shop or when a coffee from the 5-star hotel, the charges are different, but they are different with some utility for additional benefit which they are giving. You are sitting in an AC room, comfort, and other infrastructure facility, all that count. So the same doctor, when he is going to give the facility to the people in an acceptable way, giving all the comfort to the people, the infrastructure facility to the people, and we trying to build the brand of his service along with his physical, professional technique and professional outcome. That is going to be accepted by the society. See, when the corporates, the big malls coming, big hotels coming, people are able to go there and take that because they have some expectation. That expectations are meeting out. But unfortunately, that mindset is not coming into the small and medium-sized hospital. They think that This can be done only by the corporate, and it cannot be done by a small and medium sized hospital. What Indian Medical Association, we are now trying to educate and empower our general practitioners and the family physician. Apart from the corporate, they have the very most noble and most important sector is a human touch. They know the patient, they have a human relationship. When that can be combined with the business tactics of the corporate mind, I think then the hospitals can definitely able to do a phenomenal service to the society. So at this point of time, when we talk the Save the Saviors, as I said, that we need to learn expectation of the people and how to face that in a real professional business way. So as far as I am concerned, business is a good word. Business is a professional word. Business has to be there to, if you want to make the medical profession to go and meet out the needs of the society.
Thanks, Dr. Jayala. Dr. Mukamala, you want to comment on the business of medicine? In my opinion, of course, business by itself is not bad. Money by itself is not bad. These are all tools. How we are using it for helping people in balance with, profit making. So that we understand. But I want comments on the business of medicine, please.
Yeah, I mean, I think that, again, there's business breeds competition, competition breeds excellence, right? I mean, that's the way that the business world works. But critical in that is the customer, in this case, the patient's ability to make a choice. So here in America, we have this problem of what we call narrow networks, right? So a hospital system, multi-hospital system that owns, hundreds of hospitals across the country will develop their own insurance product and then sell that insurance product to patients. And then the patients are obligated to get their care from that hospital system. So it eliminates the choice that patients have in who they can go to see. So you can have transparency in pricing, right? If you want to get your earwax cleaned out at a hospital otolaryngologist, the fee for that may be $200. If you want to come to my office to have the wax cleaned out of your ear, the fee for that may be $100. But the patient doesn't have a choice of going to either of us because of their insurance. They have to go to the hospital otolaryngologist, right? So transparency is one thing, but choice is also important. So that if the patient has a high deductible plan, they're paying out of pocket for the first $5,000, which is very common in this country now. Choice is critical when you have a multitude of options. And so transparency is important, but choice is equally important. Transparency is useless if there's no choice in where you can go.
Yes, that's true. That's true. Now, do people in India have a choice where to go? Dr. Sunil Kumar, sir, people in India have a choice where to go, but it's kind of no choice in a way, isn't it? Because at least the perception in Andhra Pradesh, which I know many places, hospital, is you need to go to a corporate hospital, even though there is a government hospital. The perception is that the government hospitals are not good, and so you had to go to the corporate hospital. And when you go to corporate hospital, there is then charge that is associated. Now, the question here is, what I understand is the cost structure is kind of similar. Like even if you go to a small hospital or big hospital, they can charge whatever they want. And how do you standardize it? How do you standardize it? It's like, drinking like coffee in Starbucks here is different. It has a different price, and drinking coffee in some other place different. So how do you standardize it? And why is it not being standardized? And one of the comments that I heard from previous panel members is, based on primary care, secondary care, tertiary care, based on the facilities that the hospital has, certain pricing has to be there. What do you think about it?
Yeah, so there are two types of clear divisions in this aspect. Those who have money and those who do not have money. in the sense that lower middle class, below poverty line, and of course those who have plenty of money, those don't come under any class. They are above every class, definitely have a choice, and many of them prefer to go to foreign countries and take treatment of their choice and treatment of their doctors and choice doctors, etc. That is one class. But in India now, the new phenomena which has invaded, I would say, all the private sector as well as the government sector, and all the medical college setups and all these, by a scheme called Ayushman Bharat scheme, which was being run by various state governments in different names, different capacities, like Jana Kalyan Yojana or Atal Bihari Yojana or Indira Gandhi Yojana, whatever names may be, multiple. Yashaswini scheme in Karnataka. All these are examples of trying to standardize the cost of treatment for a person who holds those cards. Like, for example, in Gujarat government, Gujarat, there is a scheme called Ma Yojana, Ma Amrutam Yojana, that is Mukhyamantri Yojana. But now everywhere this clientele is increasing for the small hospitals also. Most of them, for the sustenance purposes, are taking this scheme, and which is already gone beyond proportion. Even in the private hospitals, in the corporate hospitals also, especially the lucrative branches like radiotherapy, cardiology, cardiothoracic surgery, these branches are very inclined. Otherwise, they don't have any clientele only. Every person who's coming in Mercedes, but would take this card with him and wants to have treatment done under these schemes. So this is a new phenomena which has started in India, in various states under different names, but now it is getting standardized. In terms of the corporate hospitals, definitely the some of the standardization has come through something called PPN scheme, Preferred Provider Network scheme, which is 4 of the government insurance companies, which are offering the health insurance. They have got together and they have made certain standardized rates for various procedures, whether it is cardiology, whether it is pulmonology, or any other branch, any super specialities as well as specialities. ICU treatment also, especially in Andhra Pradesh and this thing, they have included, even Hyderabad, they have included certain medical packages also into this. So the cost is getting standardized through these schemes in a big way. But as you said, certain hospitals, those who have taken these schemes, also compare their private charges and tell that this is a government scheme, this is a private scheme. So that kind of standardization is happening slowly, but it will take time. Definitely, people are trying to exploit certain things under this aspect, as well as for the private patients, they do charge at exorbitant rates sometimes, notwithstanding the financial status of the patient. And that's how that trust factor which we were talking about starts going away. But some of the good work is also done through these standardizations, is what I wanted to bring to the house. Thank you.
Yeah, what I'm understanding is this topic is too vast to discuss everything in one session. That is very clearly evident, and very complex too. It's very complex. There is a cost of medicine, there is a lack of trust, and then also people not able to afford. It's not cost of medicine. People not able to afford. In America, yes, we have a problem with insurance, but insurance pays everyone who goes to the hospital. They'll get treated first. Your life is saved. After that, what happens? You go bankrupt because you can't pay, or you get some kind of financial aid. This is a different thing here. But at least you get treated. That is one good thing that I like about it here. Now, it's like in the way that I compare it is like, let's say you want to Tesla, right? Now, in America, you could drive Tesla. There are charging stations everywhere. the roads are much better and it's much easier to maintain. But if you want to drive Tesla, there are no charging stations, right? That is there, the commodity is there, and so the people can't really afford it, most people, right? So the cost of care has risen so much, but the people's standard of living has not. It is creating a huge gap. There is one thing that I heard from the panelists before, right? Because everyone wants to get for example, the latest treatment for COVID, monoclonal antibody cocktail. It was 60,000, 70,000 rupees, right? Now it is available, but how many people can really afford it? The affordability is a big factor. And what I want to ask Dr. Jailal from IMA is, sir, I know that this is a vast topic and we can't solve everything in one day.
I do understand your topic, but that is what one of the big demand Indian Medical Association is making is health shall be the fundamental right of an individual. The constitutional right, the right to live is given, but health, the fundamental right, it is not being enshrined. If the constitutionally, if you say the health is a fundamental right, so the responsibility of providing that fundamental right comes with the public health department. It is a government responsibility. So even in there, the public health department has to take care of that. If you see Indian healthcare budget, our budget allocation in the GDP is 1.5 to 2% for the public health. So majority of the India, that is they sit up from the private healthcare. That is the reason why there is a mismatch, and what is that availability and the mismatch is coming. So instead of that, the government can realize it. It is a responsibility of the government to ensure the basic health care to the individual. And if the public health institutions are made as par with what is expected of the people, this issue will be able to be solved. But unfortunately, that is not happening. Though we are making it, putting it on. Now, India, the one good thing has happened is education has become a fundamental right. So every corporate hospital, school or a college has to give at least 25 to 30% of free education to every student who is meritorious, who is coming and applying. So something like that we are working that to make health as a fundamental right, and only when that will be there. And before I finish, I just want to add on that is one of the issue which Indian Medical Association we are working on, as we are talking about the trust deficit also. Now for the patient, when he is really aggrieved, he has no alternative arrangements are not there. Where he will go and complain, where he will get the relief for him. So that mechanism we should develop. That is Indian Medical Association. We are trying to make a grievance redressal. Every day I am getting at least 10 to 15 complaints from the patient saying that this has happened, something are genuine, something their demands are high. So we should protect, as we talk about the violence against the doctors, we must also provide a belief in the patients that there is an alternative mechanism. When they are really aggrieved, they can go represent and they can get the benefit. It cannot be done in a national level. It has to be done at every level. We are asking for every district, every Indian Medical Association branch, if they can have established 50% violence and their the grievances can be sorted out. That is another area where Indian Medical Association is now working on that issue, on these issues.
No, very well said. I think that is probably the single most important thing that you said today, because like a couple of other participants, Dr. Goti Mukula, Anupama, and other doctors have mentioned here, we need a healthcare system that is affordable, and probably it's like something like in UK or Canada, where the government takes care of the healthcare needs of the patients. I think that probably is a solution that we all should move towards. And, coming from, a high perspective, seeing everything that is happening at the highest level, why is it so difficult to get such an important thing? Everyone knows, right? Everyone knows your health is important. Why is there 1.52% GDP on health? And while there is so much spending on something else, and What are the obstacles? I want to really understand that, because that is what is going to solve the problem. Yeah, we can talk about trust, we can talk about organized mobs, we can talk about, financial burden, all those things. But I think this is the core problem, really. Government policy, how it is treating healthcare. I think, in my opinion, that is what it is. We have a saying in Telugu, Yadha Raja Tada Praja. Right? So whatever happens at the highest level, however they see things and how they do things, people are going to be affected by it and they follow them simply. So why is it? Help me understand, please. Like, why is it so much resistance to get these kind of things done? And we know the problem.
I guess, Kieran, I'll just jump in just real quick because you made me think of something. This is Bobby from the AMA. You mentioned a small percentage of the GDP being spent on healthcare in India. Spending more doesn't guarantee an outcome. So I just Googled it. 17.7% of the GDP of the United States is spent on healthcare, right? So almost 18%. So 10 times what you're talking about. And yet we still have similar issues where I sent you a graph actually in your email that basically shows administrative costs of healthcare in the past 30 years have gone like this. Physician compensation for healthcare is like this, right? So how we spend that increased portion of GDP has a direct impact on patient satisfaction and improving metrics like infant mortality, maternal mortality, life expectancy, this sort of thing. So spending more doesn't guarantee an outcome. It's the strategy of that spending that is much more critical than just increasing the dollar amount.
Oh, I can't say more about it. That's the kind of problem that we have in the United States, and it's not all rosy here. Both Dr. Kamala, myself, and many other doctors who practice here, they know about it. And we have like physician burnout is a huge thing here. Of course, in India too, but physician burnout is a huge thing in America, despite all the great facilities, right? So why is that? It shows exactly money is not going to solve the problem completely. Yes, that is an important part of it, but it is the policy behind it. The policy behind it, that is what is going to solve the problem. And that has to be very carefully structured, in my opinion. Having seen the American side of medicine and the Indian side of medicine to some extent, a lot of people are thinking the insurance is going to solve the problem or the government involved is going to solve the problem. It is not going to solve the problem. It is going to provide a part of the solution, but still the policy making that is going to determine. Sir, I want to get back to that question, Dr. Jailal. Like, what is the main obstacle that you're seeing? Like, IMA is a powerful body and 3.5 lakh doctors and eminent doctors and administrators like you. And when you go speak with the health ministry, what do you hear?
Yeah, there is two things are there. One is the government or the ministry works with a political background, and what is the return they get in their investment. And whatever the fund they are going to spend for the health and health infrastructure, there is not going to bring back them votes, or whether not bring back to them in the return and what they are expecting them to develop. Because it is an area where it is not a given priority choice of the people, not only the government, the public. Even if you see the households, every household will have some budget allocation for electricity, their school children education, their school expenditure, but none of them will have a budget for even their health and health benefit and health welfare. So that concept is now only slowly coming in, and the government is not realizing now the health will brings the economy also in a cascade way progression it will make. After this corona, now they are slowly realizing the importance of the health as a very important predictor for the economic development of the country also. So I do hope, at least after this COVID impact which has created and which has realized the life is more important than the wealth, the government may come forward to develop the infrastructure and put in that. But as on date, their greatest obstacle is one is the huge population, the amount of work which they need to do is very high. They always cover with an economist will come how much return back or impact it will going to create. So they are always, the economists are putting a negative thing. And more so, the most common problem what we feel in the health administration, one country where it is managed by administrators. When just because they get an IAS degree, they feel that they know everything, and there is no qualified medical professionals are there in the top level give administrative position. So IMA is also working on that, and we are now trying to bring a cadre called Indian Medical Service, like administrative service. And if you can have a person who has the medical background and importance of the medical and public health issue, and also the administrative skill, and if he is able to be there in the administrative level, I think some of this issue and making the proposal to the government. See, ultimately, what the minister decide is what his bureaucrat is going to give. What the technocrat, what the bureaucrat officers are going to give report, the most of the time the ministry is also deciding on that. So this is a big progressive decision has to be made, big impact has to be made. Slowly we are progressing on that. I do hope by at least in the next budget we will have some increase in the budget allocation that will subsequently increase. And if it is there, I don't take the word of Dr. Bobby that though USA is putting 18%, they still have a violence. But there is a lot of difference in the violence what is happening in US and the violence what is happening in India. The money is the reason for violence in India. I do not believe the money is the reason for violence in the US. It is a prestige, and it is something more is working on that. So budget allocation, if it is more, definitely we will be able to bring down the violence also to maximum possible extent.
Thanks. I think Dr. Mukamala mentioning more about the quality of care and the frustrations in the system, not per se violence. And you definitely, Dr. Jailal has enlightened us with
can you excuse me? I have to now join another meeting, so I will be.
Absolutely. I have one last thing. What I want to happen is Dr. Mukamala is here from AMA and Dr. Jailal is here from IMA, and this is the first time AMA and IMA are together on a platform, and I want this kind of collaboration. This is the seed, I believe, and I want this to grow into a tree where there is collaboration happening between America and India for the benefit of both nations.
Thank you.
Thank you. Thank you. I want to thank Dr. Jailal.
Meeting of EMA Odisha branch, that is 2-3 meetings that is in between. I would join with you.
Absolutely, no problem at all. We understand. We appreciate your time. We appreciate your time. And it's almost 1.5 hours. We need to close out this session too. And I immensely thank everyone. And I would close out with a few things that I want to share with people here. And so that's going to spark further thought about this topic. And I'm going to share briefly some things here. While we solve the problems, we need to survive. Yes, the policy need to change. Yes, we need more money. Yes, there is more accreditation needed of the hospitals. All these things are going to take time, unfortunately. And people are doing their best, doctors are doing their best. So what I propose for our healthcare professionals in this process, while we wait for the change to happen, is building resilience. That is important, and that is both America and in India. Building resilience, because we need to survive first, and we will only survive all the stress of this, what we are facing, if we become resilient beings. I know that doctors are more resilient. New study shows that doctors are more resilient than general population. We are already doing a lot, but probably we need to do even more to build that resilience. I think that is important. There is another factor constantly that I hear from people is a lack of proper communication. And that happens here in America. I see that all the time. How can we improve our communication skills so that it is going to benefit both the patients as well as ourselves. That is going to be the key. In my opinion, most of the problems in the world is because of lack of communication, 80 to 90% of problems. And that communication must happen. Yes, we don't have time. I understand that there is a problem, but how can we use the little time that we have to communicate properly? That is a skill that we all need to acquire for our own benefit as well as patients' benefit. We need to, as doctors, focus on work-life balance and gaining financial stability, also maintaining a healthy lifestyle and maintaining a positive attitude. All these things will protect us in this process. And I know that AMA is working big on physician burnout, and Dr. Mukamala will definitely see these things as something of interest for all. And then the external factors, like we talked about, the infrastructure, the policy change, and the premium quality medical education that is needed for the younger physicians. That has to happen. And the accreditation, like we talked about, Dr. Sunil Kumar Rao knows more about it. And also there is digitalization for ease and transparency in delivering care. We have to use technology for that. And there is law enforcement. All these things have to come together to solve this problem. And again, this is merely the first of, the initial, one of the most initial sessions of many other that we are going to conduct. But any last words from people about what I just shared? Yeah, Dr. Mukamala.
I think it's been a great session, Dr. Kiran, and it's been nice to have Dr. Jailal, Dr. Bobby, and Dr. Srihari and Dr. Sunil Rao Garu here for comments. And it's been a comprehensive, condensed statement that what you have given. I think, as Dr. Jailal said, financials is the main issue in India to at least 90% of them for the violence against doctors in India. And it would be different, like a pride or some kind of vengeance or some kind of hard feelings that what people have in US. So there should be a collaboration, as you mentioned, that both the medical associations should come together to solve the basic fundamental problem. And we can use technology. We can use technology in solving at least half of them, where transparency, as Dr. Bobby was also talking about, transparency and approachability as well. So we can bring in technology and we can advise hospitals to adapt technology so that people are more access to their hospital bills and how they're getting billed every time that they get it done. And this reduces the kind of burden onto each family as well. So I think the session made a lot of strong points, and we should have a collaborative sessions in future as well. And to come out, as I suggested, to some kind of policy makings, I request Dr. Bobby to take it up at a higher level, as we can see it will change a lot of things all across the world. As you mentioned, there can be something in Australia, they can be having something in Europe somewhere. So it's going to be a major policy decision that he's going to start off and storm into in the next decade to come.
Thanks, Karthik. Definitely, it's on rise everywhere, America, Australia, everywhere. Yes, Dr. Mukamala, please.
Yeah, I just wanted to say thank you, Kiran, for including me in this conversation. I think we have a tendency to look for solutions in isolation in our own environment, but yet when we live and share this planet together, there are solutions that can be learned from each other. And that's why I appreciate this conversation, just so that I can offer what the environment is here in the United States, but also learn from my mother country as well, as far as solutions and situations and cross-pollinate ideas. So thank you.
Well, thanks, Dr. Mukamala. That's amazing what you just said. We all need to learn from each other. We share that together. And that perspective is so important today, especially in this world where there's a globalization for everything, including coronavirus. So Dr. Sunil Kumar Rao, any final words?
Thank you. It was a great session, and thank you, Mr. Nageshwar Rao and Dr. Kiran, to include me in this conversation. And I'm grateful for the conversation which we had with the IMA presidents of both countries. And it was really nice. And as I said, I think from my side, I have made my points very clear that we have to, as a doctor community, we have to work together instead of making differences within our community, and fight this together. Especially this violence portion of it, which needs. I mean, apart from government support, I think we should support each other more. Then only we'll be able to solve this issue to a large extent. Thank you. Thank you.
Oh, that's amazing what you just said. Unity. In unity, there is strength. And often is not seen in doctor communities, not so much as in nursing community or as in other communities. We are very independent people, thinking independently of, and I think that's definitely something that we need to work on as physicians. And I know that we can't solve all the problems and answer all the questions in one session. I wish, I feel like there is so much more to discuss, but because we are limited by our time, thanks everyone. And then I also want to thank Mr. Nageshwar Rao, who's my friend, as well as the quality manager in eye hospitals, for helping me with this session, connecting with the different people. And Mrs. Srinija Ramachandra, behind the scenes working on the technology and all that is needed to make this happen. And I want to thank every single person in this panel, Dr. Mukam, Dr. Sunil Kumar, Dr. Jailal, Srihar Rao, and Dr. Karthik Tumala for their presence. And it's an honor to share a platform with you all today. And I look forward to connecting with you again soon. Thank you very much.
Thank you, everybody.
Thank you. Thank you.
Yep.